Should mothers use finger to point to the disabled human face while discipline? Based on best practices in child development and respectful communication, mothers should generally not use their finger to point at a disabled person or anyone while disciplining a child. Pointing is often viewed as an aggressive gesture that can signify blame, create a hostile environment, or make someone an object of scrutiny. Why pointing is ineffective and rude. Aggressive communication. Pointing a finger in a child's face is considered an aggressive, in-your-face gesture that can trigger fear or anger rather than understanding. Objectifying the individual. Pointing directly at a person, especially to highlight their disability, can be viewed as objectifying, disrespectful, and rude. It violates basic disability etiquette, which emphasizes treating people with dignity. Should mothers use slap on the face on disability humans? No. Mothers, or anyone, should not slap a person with a disability on the face. Here's why. Every person deserves respect and dignity, whether they have a disability or not. Slapping is physical violence. It can cause physical pain and emotional harm. People with disabilities may be more vulnerable and need support, not punishment. In many places, hitting someone can be considered abuse. Mothers, or anyone else, should not slap a person with a disability on the face. Every human being deserves respect, dignity, and safety regardless of their abilities. Slapping is a form of physical violence that can cause both physical pain and emotional harm, especially to someone who may already be vulnerable. Discipline should be about teaching and guiding, not hurting. Instead of using physical punishment, parents can use calm communication, clear rules, positive reinforcement, and professional support if needed. Kindness, patience, and understanding are always better and more effective than violence. Why mothers loves to bad words provoke disabled human mouth. A mother using bad words or provocative, hurtful language toward a disabled child or human is generally engaging in emotional or verbal abuse, which can stem from severe psychological issues, extreme stress, or lack of coping mechanisms. Such behavior is never normal, justified, or the fault of the person with a disability. Based on psychological perspectives and studies on toxic parenting, here are the underlying reasons for such behavior. Projection of self-hatred and unhappiness. Toxic individuals, including mothers, may be deeply miserable, sadist, or insecure, and use abusive language to make others feel as bad as they do. They often project their own perceived flaws onto the child. Narcissistic personality and control. A narcissistic mother often uses cruel words, mocking, or baiting to maintain control, demand perfection, and secure her superiority. When a family member, such as a disabled child, challenges this, she may react with rage to protect her fragile ego. Title: Why a Mother Threatens a Disabled Person When They Don't Follow the Obey. When a mother gives a command to a disabled person and then threatens them for not obeying, it often reflects her own frustration rather than the disabled person's behavior. Some adults struggle to communicate calmly when they feel stressed or overwhelmed, so they use threats to try to control the situation. In moments like this, she may say something such as, "Failure to obey will lead to your removal from the room." This kind of reaction can be emotionally harmful because it makes the disabled person feel unsafe, disrespected, or targeted. The issue is not the disability itself, but the parent's inability to express their emotions in a healthy and respectful manner. Why disability becomes a target in parental arguments. When parents argue, especially about something sensitive like disability, emotions can rise very quickly. In moments of anger, a mother might say hurtful or provoking things that she does not truly mean. This often happens because arguments bring out stress, frustration, and fear that people normally keep inside. Instead of expressing these feelings directly, Some adults attack the closest or most sensitive topic, even if it is unfair. Sometimes a parent uses the wrong words because they feel hurt themselves. When someone is emotionally wounded, they may try to hurt back, not because they believe what they are saying, but because they are reacting to the moment. Many adults were never taught healthy communication skills, so during conflict they rely on blame, insults, or sensitive topics. Disability can become an easy target in the heat of the argument, not because it is the real issue, but because it gets a reaction. It is important to understand that these words do not mean she hates people with disabilities or thinks less of you. They do not reflect her true beliefs. Instead, they show that the argument itself is the problem, not you. Your strong reaction to these comments is normal, especially because you care deeply about disability awareness, respect, and dignity. When someone uses disability in a negative way, even out of anger, it affects you more because it goes against your values. Why does parent says that your mouth sykes smell bad to disabled person? When a parent or caregiver tells a disabled person that their mouth smells bad, sykes, it can stem from a variety of reasons ranging from genuine health concerns to, in some cases, harmful psychological tactics. Based on commonly reported experiences, here are the potential reasons. 1. Medical or hygiene-related reasons. Actual oral health issues. The smell may be real and caused by underlying conditions, such as dry mouth, xerostomia, poor dental hygiene, tooth decay, or gum disease. Why a mother might say this. If you are trying to understand her intent, consider these possibilities. Real hygiene challenges. People with certain disabilities may have physical difficulty brushing their teeth or cleaning their tongues effectively. Bacteria can build up on the back of the tongue and cause a strong smell that the person themselves cannot detect. Communication or understanding differences. In some cases, especially where someone needs support with daily care, a caregiver might bring up hygiene because the person needs help brushing properly or remembering routines. Important point: even if there is a hygiene issue, it should still be spoken about respectfully. Calling someone's mouth sykes in an insulting way isn't a kind or helpful way to address it. Why does parent get attention to normal child instead of disabled human? Some mothers may seem to pay more attention to a non-disabled child than a disabled child for several complex reasons. One reason is social attitudes toward disability. In some communities, disability is misunderstood or unfairly viewed as a limitation rather than simply a different way of living. Because of these attitudes, some mothers may unconsciously place more focus on the child they believe fits society's expectations more easily. This is often shaped by outside pressures, not by the disabled child being less valued. Stress can also affect how attention is given. Raising a disabled child may involve constant caregiving, medical appointments, financial strain, and emotional exhaustion. A mother under heavy stress may focus so much on meeting survival or care needs that emotional attention can seem reduced. Sometimes what looks like neglect is actually burnout or overwhelm. Another reason can be lack of support. When mothers do not have help from family, schools, health services, or the community, they may struggle to meet every child's needs equally. Without support, a parent may make choices that seem unfair, not out of preference, but because they are carrying too much alone. Misunderstanding disability can also play a role. Some parents may not fully understand a disabled child's emotional, social, or intellectual needs. They may focus only on the disability itself and overlook the whole person. This can lead to less engagement or fewer opportunities being given to that child. Why does mother and twin sister fighting or bullying disability humans? That situation is really serious, and it's not okay. A person having a disability should never be bullied, especially not by family. There isn't just one reason why a mother or twin sister might act like that, but here are some common explanations, not excuses. 1. Lack of understanding. Some people don't understand disabilities properly. They may see the person as different and react with frustration or ignorance instead of empathy. 2. Stress or pressure at home. A parent might feel overwhelmed, emotionally, financially, or mentally, and instead of handling it in a healthy way, they take it out on the child. That's still wrong. 3. Jealousy or sibling rivalry. A twin sister might feel like the disabled sibling gets more attention, care, or sympathy, which can lead to jealousy and bullying behavior. 4. Cultural or personal beliefs. In some families, there are harmful beliefs about disability, like seeing it as a burden or something negative, which can influence how people treat the person. 5. Learned behavior. If someone grows up in an environment where bullying or disrespect is normal, they may copy that behavior without realizing how harmful it is. But here's the important truth. Bullying is abuse. It's not discipline, and it's not justified. Being disabled does not make someone less valuable or deserving of respect. If this is something you're experiencing or seeing, you shouldn't handle it alone. You could consider talking to a trusted teacher, a school counselor, another family member you trust, a social worker. You deserve to feel safe and respected at home. Why does mothers have problem with disabled person who interact with girls? Overprotection. Mothers of disabled children often develop an intense habit of protecting them from the world. She might be terrified of you getting your heart broken, being rejected, or being taken advantage of by others. Fear of your future. She may be worrying about how you will navigate adult relationships, sex, or marriage, and because she does not know how to guide you, she tries to stop the interactions completely. Her own awkwardness. She might not know how to talk to you about girls or dating, so she acts out of anger or strictness instead of openness.